Hello and welcome to another Debating Europe Citizen panel with me, Joe Ludobarski. I'm the editor-in-chief of Debating Europe, and I'm joined here by a couple of citizens who are going to go through with me some of the questions related to a panel at Friends of Europe's State of Europe Roundtable event in Brussels on October the 27th, and this is about healthcare. It is going to be on rewiring or revolutionizing health systems. We've had a little bit of a chat now earlier before we started recording, and we're just going to have a talk about, general impressions, what's interesting for us, which questions maybe bubble out of this. The idea is that we want to hold the citizens panel in advance of the session on the 27th of October, and then we're going to try to put some of the output from this discussion into State of Europe. So we're going to take some questions that my two panelists have come up with, put them to policymakers, to experts at State of Europe, and see what they say. But first, before we start the discussion, I've got to introduce my panel. First of all, Dana, thank you very much for being with us. If you want to just introduce yourself briefly to the viewers.
Yeah, sure. Thanks for having me. My name is Dana van der Hurk. I live in Rotterdam in the Netherlands, and I currently work as an HR advisor in a hospital.
Wonderful. Okay, so you're going to have some kind of very personal experience here about healthcare systems and how they're working. Excellent. Welcome, Dana. And João, if you want to welcome as well, if you want to kind of introduce yourself.
Hello all, my name is João. I'm from Portugal. I currently am doing my PhD as a biochemist at an oncology hospital. So very related to the topic today.
Perfect. Okay, so you guys have got more kind of background than me on this, so I'm going to be taking your lead. Okay. So first of all, let me read the description of the session, and then I want to hear from both of you. What are your thoughts? When this topic can go in so many different directions, and you guys are going to steer this, so it's going to be really what interests you. So the session at State of Europe, the description we've got on the website is COVID-19 opened the Pandora's box of healthcare inadequacies across Europe, but also left hope that member states could overcome the differences to cooperate in radically new ways. The EU and its member states had to work differently and cut through operational barriers to manage the health crisis through new forms of cooperation, despite limited EU competence in health. The pandemic crucially revealed the links between health and stable, well-functioning societies. The close collaborations and innovations of the past 2 years could be leveraged to build efficient, cost-effective and high-tech health systems that deliver for all. There's a question mark there. I'd be interested to know what you think about that. And then final paragraph, a Europe-wide settlement on how to tackle health crises in the future is needed, from revitalizing the depleted health workforce to creating a world-class data environment. There are big challenges for health systems to overcome, but also opportunities to build and progress. The identification of health as a strategic sector opens the door to new financial investments and greater interlinks within Europe for health services and supplies. As Europe gets to grip with the big tasks of shaping the green and digital transition, health is a building block in the new vision of European economies and societies. Okay, so it's kind of like, what are the lessons learned? What are the opportunities? When I read that, what comes to mind? What are kind of some of your thoughts, maybe either answering the questions or things that you're a bit critical of, or you're not sure how it's framed? Let's start with Dana. Let's start with you maybe, and then I'll come to you, João. What kind of comes to mind when I kind of go through what we're going to be talking about at State of Europe for you?
Well, when related to Corona, to COVID, I think that one of the main things that all of us learned is that health is more than just not being ill. In the Netherlands, we are currently implying this system. It's called positive health. I'm not sure if the two of you are familiar with it. And it's a way of looking to health way more holistic than we did before. And then you've got this approach. We have 6 dimensions, and you have body functions, mental well-being, being part of society. And it's a bit moving towards prevention instead of just treatment, which is difficult simultaneously, because it's more attractive to treat and to put money into funds that can come up with treatments, because then you've got direct financial results. While prevention may be way more important, And I think that is one of the main things that we can take out of COVID-19, and also the influence of technology. We were forced to use technology a lot more, but still there is quite a lot of resilience in some parts of hospitals. I can only talk for myself, towards working with technology, while it actually improves the quality of health and also the quality of care, because it's also two different things, and it can leave employees using their time for research for future treatments. So that comes to mind at first.
Okay, no, I think that's really, really interesting. And I as part of kind of debate in Europe, we spoke to, this was during the pandemic, it was last year, this guy called Joe Mays, who's the chair of, Joe Maas, who's the chair of the Cross-Border Patients Organization, European Empowerment for Customized Solutions. He's from Maastricht, which is where I'm based actually. And he was saying, he was talking about positive health, and absolutely, he said very much what you were saying, Dana. He was saying positive health is something I think he defined it as the ability to adapt and self-manage in light of the physical, emotional, and social challenges of life.
Yes.
And so kind of redefining what healthcare is, as you say, not just being about what is not being sick, but kind of having a more positive definition of it, which I think is fascinating. I wonder how that interacts with this question of technology, because then it starts to, if positive health means being able to kind of self-manage, does it mean then a kind of a basic competency in health technologies and kind of, health, these kind of questions which you're coming up with. So this is fascinating. I don't want to, let's bring in Joao as well, because maybe he's got some different thoughts that popped into his mind. So Joao, when we're talking, was it kind of similar things that you were thinking about, or was there something that you were like, oh, that's interesting, this is, I'd like to learn more about this.
100% in agreement with Dana. My question is, everyone is talking about European health integration, but what first comes to mind is what is being done to change from a reactive to a preventive system, because as we noticed with COVID, we are not ready to prevent anything. We're just working to react to things that happen. And that's especially important because the demographics of the Union are changing. We have recognized that with the Commission's Green Paper on Aging. And people, as we tend to age, we tend to accumulate deficits in our health. So we're talking about obesity, diabetes, stuff like that. So we're going to have a bigger pressure mounting on the system. How are we changing from the reactive to a preventive system on that side? Then we have the digitalization, because everyone is talking about, okay, we're going to change and we're going to digitalize the system, but are the healthcare workers ready for that? Are they prepared? What is going to be done to revitalize the workforce? Because I speak from Portugal, and as I look into our healthcare workers, I don't see them ready. And I've seen some studies actually with surveys to healthcare workers, and one of the barriers to changing to digitalize things is the healthcare workers. They are not ready. They don't feel ready for that. So what's being done on that side? And then finally, the interoperability, because I know this is a problem across the Union, is if I'm doing an exam at an hospital and then I go to another hospital, how is that hospital going to have access to my exam on the other hospital? I know there's some things being done with electronic health records, but I know they are not very good at the moment. So what's being done on this basic stuff in order for we to evolve to an integration to the European Union level? That's my main concerns right now.
Okay, no, there's a lot of overlap there. I think that's fascinating. Maybe I can get Dana's response, because you talk about revitalizing the healthcare system, like recovering from the pandemic. I mean, the pandemic was, it was a traumatic event for everyone, but healthcare workers were really on the front line, and this is the kind of cliche. And so I think, we've all heard reports, and you'll be very familiar with kind of, burnout and exhaustion, and the sense of, that the system was put under huge amounts of stress. So Dana, what are your feelings about, maybe in your own country, where are we? Has that revitalization started to take place? Do you think that there's a lot more that could be done on that? How concerned are you with this sense of like how recovered our healthcare systems are from the pandemic?
Well, we are not. So I'm very concerned with it. Right now, over 60% of the employees that are absent at work at the hospital I'm working at is due to psychological issues. You can, roughly say that the other 40% is due to long COVID. And then you have to imagine that, for example, if you have 10 employees in one department and 4 of them are absent, the other 6 are not recovering from COVID or from mental health issues, but they are put under lots of pressure. It's very difficult to get new people working into the healthcare field, because there are other branches which are more attractive in terms of salaries, in terms of working hours, because we once decided together, which I think is a good thing, that health should be available to everyone 24 hours a day, but that does demand quite a lot from the people that work in those systems. And another, I wouldn't call it a positive development, but rather a negative one, which I notice is that, patients are getting, how to put it, they are becoming more critical, which is a good thing. But I think that 50 years ago, patients were very obedient towards doctors, and they would just accept everything. And I think that it is very good that we are moving towards a more, deciding together what you're going to do, and exploring different options. But there are quite some employees that have, it's not a shop hospital, and healthcare is not shopping. So if there is something which has to be fixed with your health, some people are like, okay, well, then you have to fix it for me, and you have to fix it now. And if it's 5 minutes late, then I'm going to be there. Then I'm in, So
expectations have maybe changed over the years, and it's perhaps some of those expectations are out of kind of joint with the the capacity to deliver. Exactly. And this is perhaps can lead to frustration for both the healthcare workers and the patients as well, maybe. So I mean, I think so for me, because can I just ask you what, because Joao raised this point of look, there are some long-term trends as well with the population of Europe, including demographics. We're getting older, but also there's issues with obesity and diabetes and so on. Are you optimistic? Because you said there are some less positive trends. Are you kind of, if you think about the future of healthcare in your country, are you optimistic that the healthcare system is going to be able to meet these challenges, or are you feeling like there's some waking up that needs to be done? This is where are you in terms of optimism and pessimism? Are you hopeful, or? I'm
always hopeful. Otherwise, life would be very grey, and that's not my piece of cake. And I think that people are waking up already, but we can transcend the waking up quite a bit. And then it's not just people working in the healthcare systems, but also society. And that's more related towards prevention. That's my personal opinion, that everything is interrelated. So if you smoke, you spend quite some money on cigarettes, which is your own decision, and you can decide for yourself. But then the chances of getting into financial stress are bigger, specifically with the prices nowadays. There's also a job for society itself, if you understand what I mean. Because it's too easy to but that's my personal opinion. It's too easy to smoke 60 years and then you got diagnosed with lung cancer. And well, nowadays, everybody knows that smoking is bad for your health. Like prior, we didn't know, but now we know. And then to just knock on the door of a physician and say, please cure me, and it has to be done now. And I already waited for 10 minutes. So there has to be some waking up in society as well. And to give another example, I think that there is a big job for the government, also, European scene, that they have to make it way more attractive to live healthy. And I know that that's easier said than done. But I once was with this doctor, and we had a child which had it was 30 kilos over normal weight. And the parents were, they were there as well. And maybe it's too easy, but they explained as their financial situation, and then still buying candy is way cheaper than buying vegetables and fruits. So if the mother gave the child a Snickers a day, it was financially better for her, and the child stopped worrying about getting food. And then those are decisions that people have to make in their daily lives. So in order for the society to change as well, and to join the prevention side of health, we have to facilitate that from a governmental perspective.
Yeah. Oh, I mean, you've managed to encapsulate, I think, the challenge really, really well. Joao, I'll bring you in to hear your thoughts on this, because this is the tension maybe between public health, individual responsibility, but also the impact, expectations, as you said. Because I suppose one of the kind of concerns might be, I don't know if you share this, that if we moved to a more kind of positive health approach, if we were focusing more on prevention, there is a risk that is kind of that a lot of burden is placed on the individual. And that kind of that's a social kind of what's the word, responsibility or approach is kind of abandoned. Joao, maybe I can bring in your thoughts on this, because you had talked about kind of the importance of placing more kind of emphasis on prevention. This is a big question. How do you see, I guess, the balance between, or maybe you don't agree that it's even a kind of intention, I don't know, the balance between kind of keeping healthcare systems both kind of affordable so that we can have a high quality of care, yet also kind of, wanting to kind of not let people get, fall through the gaps, not have people left behind, so that, this is the question of healthcare, really, isn't it? I guess I'm asking you, where do you sit on this? What are your kind of thoughts about this massive issue?
Contrary to Dana, I'm very pessimistic at the moment, because I feel that what we're witnessing is the collapse of the system. And we're seeing that because the work that should have been done in the previous 50 years was not done, and we all know the bad things that, for example, tobacco causes, as Dana was saying. But are we really making an effort in order to prevent people from smoking? Because it's very easy to say, oh, so these many people get lung cancer if they smoke. But do people know the consequences? Have they seen the consequences? Because
I think you've cut out that.
I'm willing to bet that if people were seeing the consequences. Can you see me already?
Yeah, you're back.
Oh, okay, sorry, my connection is a bit unstable.
That's okay.
You were the message.
You were saying you're willing to bet that if people saw the consequences.
Yeah. If people were seeing the consequences in person, I think a big percentage would stop smoking. And we need to make those kind of decisions. We need to start with when we are kids, not when we are adults. We need to change from the focus cannot be the adulthood, but since childhood. and we're going to have some dark years ahead before we start to see the benefits of doing that literacy early. And when we talk about tobacco, we can say that about anything that is health related. We need to start early, and we need to start strong.
I mean, this is the classic public health question, isn't it? How kind of
regarding that, the question of
sorry, I think there's a bit of a delay, Joao. I didn't mean to. What were you going to say? Sorry. I think there's a like a few seconds lag, so you're probably only just hearing me now. But I wanted to just kind of jump in and say this is the classic kind of public healthcare question, which is almost like how social should it be, how much should be left to individuals, how much to society as a whole. And then I guess an additional question that we're interested in is this question of how European, like what is it, when I say how social should it be, do I mean social within like a member state, within a nation? Do I mean like you're at the European level? Like this is, I think, an interesting question from our perspective. Dana, I wonder if you want, you know, we're about at the end of our chat, but just if you want to just kind of talk about this European dimension. Do you think that there could be a greater European dimension for healthcare, or you think that actually no, a lot of these questions are better dealt with at the national level, at member states? You know, what are your kind of own feelings about this?
Well, I think that at national level, the thing that we do better than at European level, not like on Dutch level, but I think that the more local you go, the more you have feeling with what is going on in that region and what is needed, also in terms of prevention. For example, if you have like high risk regions with people living in a lower socio-economical status, in terms of prevention, they will need a different approach to not go smoking, to have coaching and eating healthy, to have specific attention for certain families. And I think that that's better left at local level. So not even national, but local, but then that's captured within the national system. And I think that what we can do better at the European level is the interchange of data, because we are moving towards a society in which people are more and more working remotely, and there are all these campaigns of like, oh, you can also do your office work in Spain on a beach. And I'm like, okay, well, let's go. But then if something happens to me and I'm at the Spanish hospital, they haven't got my data. It's critically, difficult to see into the system what's my medical history. And I think that, but maybe I'm touching a sore leg right now, but there were some players in that field which have a lot of power, nowadays data is power, and I do see a very important role for the European government to pull efforts together and to make sure that there is a better data transfer logistics towards the entire of Europe. Yeah.
No, that's an excellent point. Raises questions about, you know, privacy, security, you know, all these issues. I think excellent points. Joao, you also, sorry, we had a kind of connection issue, and I think you wanted to say something, and I interrupted you. Maybe I could get your thoughts on that. What you've just finished your thought, what you were going to say, and also this question of you know, you talked about interoperability and so on. What about the kind of European interoperability? Is it just data? Are there other things that could be done better in terms of coordination at the European level? What are your thoughts on this?
Yeah, I mean, of course, there's many things that the European Union can do. For example, we could have European centers that are specialized on some disease. For example, let's say the transplantation of organs. There's a center or 2 or 3 centers spread across the union that do this with a precision level that is not achievable at a country size, you know. So there's a lot of things that can be done at the union level. Not only that, but even let's say we saw that with COVID patients. So why not with other types of patients, you know? And then also the, how do we say, exchange of professionals, you know, having professionals go abroad and and do some period abroad to see how things are done at a certain place where things are done very well, you know, exchange of good practices. And then regulation, of course. The European Union has a good tradition of regulating areas, sectors. We've seen that with the how do we say it in English? I know the acronym in Portuguese, the data protection rule.
I mean GDPR?
Yeah, GDPR. I was having the Portuguese acronym on my head. So I mean, there's a lot of things that the union can do, but unless governments are willing to lose some of the power they have on health, I don't see it happening as soon as it could happen, you know. But regarding the other part that I was finishing, I feel that health should always be free, whatever your status is, you know, because that will have consequences on a society level. If you are healthy, you can work, you can produce, you can give something back to the society. So it pays itself to be healthy and to have healthcare to everyone, you know. So that was the thing that I was finishing before.
That's an excellent point. It's a wonderful point to leave things on as well. We covered a lot. It's a broad topic. And there's clearly more that we could say, but I think this is a really nice kind of high level rundown of some of the issues and the topics. Very rich. Thank you both. Thank you for watching at home. So stay tuned also for the State of Europe Summit on the 27th of October, when we're going to kind of be presenting some of the discussions that we've been having ahead with citizens and civil society. Thank you both to my panel for taking part, and thank you for watching.